Hey, Dr. Asha here.
Dr. Asha Shahjahan.
I'm the Director of Community Health at Beaumont Grosse Pointe.
And is a family medicine physician and medical director of community health.
About to get started with my day.
So you do test positive and you do have symptoms. Nothing has changed in terms of guidelines for that.
Because once you have COVID, a lot of times you can have long hauler syndrome and other things. So it's important that your doctor, your healthcare provider knows that you've had COVID. People that are recovering, that have had COVID maybe 2 or 3 weeks ago, that are still having maybe a persistent cough or still having some fatigue.
So you want to make sure that it's at least a 3-layer surgical mask or an N95 or higher.
The best thing to do is that if you were exposed to COVID or if you've had symptoms of COVID, to not test right away with the at-home test, but wait until day 3 to 5 and test during that time, because you're more likely to have an accurate test. 2021, I've been seeing an increase in the number of people that are coming in with alcohol problems. Mostly it's younger women between the ages of 30 and 40 that are coming in saying that they're drinking every single day. Up to 20,000 Americans have been hospitalized each year for carbon monoxide poisoning.
Oh my gosh, it's now we're going into 2022 and we still have so many cases of COVID. Like, what is going on? This thing is never ending.
We've been more stressed out. People have been at home. They haven't been very active. People have been eating differently than they normally do. Not going to their regular doctor's appointments as they would normally to get screened. And then alcohol consumption has been on the rise, which has also contributed to elevated blood pressure levels. If you feel like you're turning to alcohol to calm your nerves or to feel better, that's a warning sign. Normal blood pressure is actually 120/80. So unfortunately, during the pandemic, there's been about a 2-point change in the average blood pressure of both men and women. If they're able to stop drinking completely for a week and they do well, then I'm a little bit less concerned. For those that feel like after a week they get a little edgy, they feel more anxious, or they feel like they have to pick up a drink again, then I really consider that they should go to a rehab program.
To know how hard your body works to cool itself on a day where it's very hot and it's very humid. Let's talk about it with Beaumont Dr. Asha Shahjahan. And doctor, when we've got this humidity, it is battling our bodies, right? Explain that.
So your heart is working twice as hard in the summertime than in the wintertime because it's pumping to bring blood to your skin because it needs to sweat to cool your body.
Okay, and when it's very humid and that sweat is just sitting on your skin's surface, that means your body is struggling to cool itself.
So when it's humid outside, it gives you a higher risk of having heat exhaustion or heat stroke because your body is not able to evaporate the sweat that's on your skin.
All right, age makes a difference in this too, right?
Absolutely. If you're over the age of 65 or under the age of 4, your body has a higher problem being able to regulate its temperature.
And if you see somebody collapse in the heat, what's going on there?
Yeah, so one thing, we talked about the heart. Your heart's working really hard, and if your heart's not able to pump enough blood to the organs that it needs to, then you might collapse. Your blood pressure may go down, that causing you to collapse and also feel dizzy. Your electrolytes are depleted when you're sweating excessively. Sodium, potassium, it can cause irregularities to the heart. So these are all reasons why people end up collapsing, which is like very serious.
Okay, so also a good reason why you need to be drinking lots of water, of course, and maybe even a sports drink.
Yeah, electrolyte drinks, the electrolyte water are great because they help replete those electrolytes that go down.
So to get the facts about the flu, we are joined by Dr. Asha Shahjahan, a physician with our sponsor, Beaumont. Thank you so much for being with us this morning.
Thanks for having me.
Absolutely. But first, can you help us with kind of just giving us a quick list of the common symptoms of the flu?
Yeah, so the flu typically appears with a headache, fever, runny nose, sore throat, cough, and then body aches.
Okay, so what can people do to try to avoid getting the flu at all?
So the number one thing you can do is get a flu vaccine. That's the best way to prevent getting the flu. And then also social distancing as well as masking and then washing those hands with soap and water.
Definitely washing those hands. So here's another question for you. When it comes to a fever, how high might it be and how long might it last? Because fevers are kind of, something that are a bit misunderstood, I would say.
Yeah, so a fever is 100.4 degrees Fahrenheit. That's what a fever is considered. And when you have the flu, you can range your fever from 101 to up to 103 or 104. So it's a large range, but anything above 100.4 degrees Fahrenheit is considered a fever. And again, like a high range would be about 103, 104.
So is a high fever dangerous, or is it just a symptom of what we're going through?
So a high fever can be dangerous. So anything above, again, like around the 103, 104 range, you can actually have brain damage or heart damage. You can also have seizures as well. So these are all things that you want to avoid. So as soon as your temperature starts getting to about 101, you probably want to take an antipyretic, which is a medication such as acetaminophen or ibuprofen to bring your fever down.
Okay. So now, if someone has the flu, are they contagious?
Absolutely. You are normally contagious a day before you present with symptoms, all the way up to 5 to 7 days after presenting with symptoms. So it's, again, really important to keep washing your hands. And if you are sick, to wear a mask to prevent infecting other people.
I know the research goes back and forth as one of those things. Should we be getting tested for vitamin D deficiencies?
So it is pretty controversial. And I would say in the past, people used to screen people for vitamin D, but the newest recommendations are really kind of going against that. So unless you're extremely symptomatic, meaning you're having fatigue or having any type of other condition that might lead a doctor to test that level, it's not really routinely recommended anymore.
I want to tackle some of your questions that we got on our Facebook Live. I deal with it during holidays or winter. This is a telltale sign, right, that this is seasonal affective disorder?
Yeah, absolutely. This is something that happens only during this time. So if you feel like it only happens in the winter and during the holidays, it might be worth checking in with your doctor for. In the summer, you got to just check with your body. So if you already have dry lips, you feel like you're thirsty, you're sweating a lot, that's an indication that you need to drink more water.
There was a trend where people were seeing that in hotter temperatures, there was an increase in suicide rates by almost 2%. More ER visits and mental health complaints from patients with depression and anxiety and aggression. It can really impact anyone. You don't really have to have a history of mental health disorders.
When I started really getting into doing work for the homeless population, I realized that I had a unique space that other people, a voice that other people would listen to. And that's when I think maybe the leader was born. I feel like COVID-19 has changed me in the fact that it's made me a lot more mission driven and looking at the problems and the gaps that occur in healthcare and how do we fill those gaps. It's not about medicine, it's about people and really understanding people's social circumstances and how do we address that. I was working night shifts in the hospital, I was working day shifts at the homeless shelter, I was writing op-eds during my free time, I was doing news interviews. What charged me was that I wanted to empower people. This is an important moment, this is a defining moment for everybody, and you can either use it to help change the situation or you can keep it at status quo. And I was like, we gotta make some changes.